One of the big factors on the mind of the market, which may be making it nervous, is the rise in COVID cases once again. Several areas, not only in Maharashtra but across the country, there are areas where we are seeing a sharp rise. Dr. Rahul Pandit is joining us right now with more perspective of where things are heading. Dr. Pandit, good afternoon. Thank you so much for your time. How have you been reading the rebound in number of cases and the way government is swiftly acting on it? How serious is the concern?
It is extremely concerning. The more concerning is the fact that the test positivity rate in several districts across Maharashtra is around 15% or so. Even the Mumbai test positivity rate is hanging at around 6-7%. That one thing means that we need to increase our testing. Obviously, the cases have basically increased because the COVID-appropriate behavior was at an all-time low couple of weeks ago. Things have improved since then. And the testing has also improved since then. And hence, you are seeing a large spurt in the cases in Maharashtra. Because Maharashtra in the last couple of days has been testing more than 1 lakh tests. We need to increase our RT-PCR share instead of the antigen test to around 70% or 80% to be done by RT-PCR and only 20% to be done by antigen, so that we actually are able to quickly identify the people and isolate them, and if necessary, institutionally isolate them. Other thing which we need to do is we need to actually do a contact tracing. Behind every person who is positive, we should basically be tracing up to 30 contacts, or 80% of their near contacts should be identified within first 24 hours, and they should be isolated and then subsequently tested. And that is where I think we need to concentrate our efforts. A parallel effort in sprucing up the vaccination drive would also go a long way in actually controlling the whole situation for us. So this is what I feel. I think the COVID-appropriate behavior needs to be reinforced, and we need to do contact tracing, treating, and testing very, very aggressively.
Right. Dr. Rahul Pandit from Fortis Hospital there explaining that COVID-appropriate behavior actually holds the key. Dr. Pandit, thank you so much for your time today.